Dr. Gina and I are going to talk you through hopefully a brief debriefing from our buyout day. We had 30 horses come in. We went through about half of them the first day and half the second day. And if you haven't watched these buyout debriefings, they're tough. Buyouts are hard days. We have to make a lot of hard calls. And so we're just going to quickly touch on the information for each animal and not go super in depth. I'm going to try not to go super in depth. So our first horse was a 15-year-old quarter horse gelding, super, super sweet. Our supporters named him Casper, and Casper was in really rough shape. He had a grade 6 out of 6 heart murmur with a point of maximum intensity on the left. So that's the most severe heart murmur you can have. He had reduced GI sounds in both upper quadrants. He had a really deep open wound on his withers that was packed with maggots. He also had wounds in both carpi, and on radiographs, we were able to determine that the right carpal wound communicated with the distal carpal joint. There was a gas tract present from the outside into that joint, and you can kind of see he's kneed over in that picture. He also had deep, deep bony fragments and gas tracts on the wound in his withers extending deep down into his body. So he was only 15, but unfortunately, he already had severe deep infection, and he was given the last act of kindness.
All right, so our next horse is Blue. If you watch the footage of him from that day, it is very, very heartbreaking to watch how he moved around. He's 34 based on his teeth, blue roan quarter horse gelding. His left carpi, or his left carpus, was fractured. It was very obvious with the way he was moving. And he also had, we took blood and ran his blood work, and he also had a lot of really severe changes on his blood work, which we won't go too much into that. But his heart rate was 60, and we gave him Banamine, and his heart rate was still elevated. And Banamine, usually, if it's going to work, works pretty quickly, and their heart rates go back too close to normal range. But he was just too painful, and we couldn't control it. So with that fracture and his body condition and the blood work results, the last act of kindness was the best thing we could have given him.
Super sweet boy. Yeah, we give anything that's painful pain meds. So if we don't mention that, I promise I got pain meds. Yeah. B24409, also quick comment. We try to address the most severe pain, unstable cases first. So there's a lot of euthanasias that are front-loaded, and we have some happy success stories later on, so stick with us. So this horse, B24409, our supporters named Gunner. He was also very, very sweet. He was down in the trailer when he came, and he was in really rough shape. He was able to get back up. He had a laceration on his face, a lot of different injuries, most severely his right hind fetlock, but his heart rate was 80, and he had just an overall stiff, painful pain on palpation of his back. His heart rate did not come down with pain medication, and we ran a bunch of blood work on these guys, so I don't want to go too in depth, but he had very low platelets and low lymphocytes. It just overall was uncomfortable, and we weren't able to manage his pain, and he was given the last act of kindness. His poor buddy.
Yeah.
He also had dental pathology.
Yeah.
Next horse, please.
This is what our fans called Gibbs. He is a 35-year-old gelding quarter horse bay that came in. His heart rate was normal. It was 30, but his respiratory rate was elevated, and his effort was also elevated. He was really good for pokes, and he had a really good disposition, but he was missing 7 teeth on dental radiographs and also on examination. He also had muscle wasting, a lot, very, very severe in his hips. His left was worse than his right, and he had right eye enlargement, and he was missing his incisors also, and his cervical and thoracic palpation, he was very painful. So he was given the last act of kindness, unfortunately, because he was just so broken down by the time we got him. That was the most kind thing we could do for him.
This little pony was a 26-year-old little paint. He was in really rough shape. So neurologic disease is something that you can't see from a photo, but if you watch the footage of this guy, he was very, very abnormal. His brain did not know where his legs were in space. He did not have a pupillary light response in either eye. So he was visual, but his eyes didn't respond to stimulus of light. So that indicates a major abnormality. And he was either neurologic and or had possible upward fixation of the patella. In my memory, he was more neurologic than not. And the abnormalities affected all 4 of his limbs. He had a lot of pain on palpation of his back, middle of his spine. He also had increased lung sounds, increased respiratory effort, and he had some crackles in his lungs in the left caudal. So he had increased lung sounds in both lungs, but it was more severe in the left. And he was given the last act of kindness. He was really cute. Some of these guys were missing. So we pull blood and then we come down and we run the blood work and it's all in their medical records. Oh, he also had elevated GGT, total protein, and globulins. Oh, next horse. Okay.
Yeah, that's Blaze.
Sorry.
This is Blaze. She's our 3-year-old quarter horse mare that came in. She was very scared. She seems to be doing okay now in her area where she can calm herself down. She has really long feet that need to be trimmed, so we're going to have the farrier work with her on that. She was not good for pokes, but I don't think she's had much handling or experience with that. We did pull her blood and do a CBC and a chem. CBC is a complete blood count. She has elevated neutrophils, which is a sign of inflammation or infection somewhere. That was the only thing on her CBC that was abnormal, but she did have a GGT of 28, which is liver, and high for us on our machine is 24. So that was the only abnormality on there, besides her total proteins and globulins were elevated, which also mean inflammation. So it could have been something that she ate or didn't eat. Sometimes horses, when they don't eat, their liver gets a little upset, but overall she looks okay. So when she comes out of quarantine or right before she comes out, we'll recheck her blood work and see how she's looking, but she's pretty happy with herself, so.
This mare, our supporters named her Arabella. We were able to track her standardbred brand, and her name was Babs Victory. She was heart rate of 62 that did not respond to pain medication, and she was very, very painful on palpation of her spine. We took radiographs of her spine and found some significant abnormalities. I wish I had the radiographs pulled up in front of me. But she had she had severe back pain. She also had very, very low platelets and elevated neutrophils. So she had painful back with bone touching bone. So when you have osteoarthritis of your back, there are types of surgeries that you can do to alleviate that discomfort, but hers was advanced and it was present in multiple areas across her back. Upper end of normal heart rate for a horse is upper 30s, so a heart rate in the 60s with pain medication on board is not a good prognostic indicator. And she was given the last act of kindness. She also had some mild GI abnormalities.
Oh, Snuffy. He was really
guy.
cute, yeah. He was at a really advanced stage of Cushing's. We did a Cushing's test on him. I wish I had written the blood work results down on here.
He was the 700s, right?
Yeah.
Yeah.
Yeah, he was over 700, which normal for adult horses and ponies is like 17 to 60, and he was 700, so he was way up there. And he just looked like he did not feel very good, but we aged him at about 30 based on his teeth, the gelding Shetland pony. But he also had abscesses with draining tracts in his face. We took radiographs, and it was pretty significant and severe. The Cushing's test, his CBC chem was also abnormal, and he also had an elevated respiratory rate, so he was having difficulty breathing. With all
He
those,
was so painful. His face hurt so badly.
yeah, and he was such a good boy, so you know it. somebody loved him at some point because he was very, very sweet and good with people. But based on all those findings, he also had a really low platelet count. But the last act of kindness was the most kind thing we could do for him at the point that we got him.
Just a tiny side note, Horse Plus is continually supporting us in finding additional diagnostics. So the Cushing's test, we haven't been able to do in-house until recently. We worked with a company and they provided the equipment and we just have to buy the rotors. So it's easy to look at a horse that has hirsutism and is very aging and go, well, they probably have Cushing's disease, but to be able to tell how bad it is, in the 700s, they're not likely to respond well to those therapies. And so we see a lot of horses that we've kind of made that a presumptive diagnosis, but now we're able to actually put a number on that and gauge severity. So it's really great to have those numbers.
Yeah. And Cushing's and PPID is not an end life sentence, but when it's so far advanced and the horses are so far beyond any kind of help we could give them, that's when these decisions are made. But there are treatments out there for horses if you catch it early enough.
Yeah. We didn't do a good job writing down notes. This is me. This handsome boy's name was Donald. He was only 15, which makes things extra heartbreaking.
He had painful ring bone.
Yes. He had, so the first thing we noticed was that he had a mass on his penis, that the top differentials for a mass in that location in horses are malignant types of cancer. So we took a really close look at it and we thought, we might be able to resect this mass, but we continued with his physical exam and we found that he was very, very painful in both his front legs. And you could palpate ring bone from the outside, but the radiographs of that ring bone were severe.
He had a floating chip, didn't he?
Yeah, he had devitalized bone. So if he had just had, even if it was cancer, say it was squamous cell, because it probably was, and we had been able to surgically resect it, you can do local radiation chemotherapy. But this was a horse that was so painful just standing, and there was nothing that we could have done for his ring bone. And he was such a sweet boy. And he was given the last act of kindness. He also had pretty significant infection, very elevated white cell count, neutrophil count, and he also was anemic with very low platelets. Next horse, please.
This is Bo. He's our 19-year-old Arabian gelding that we have up in quarantine. He had mucoprolate nasal discharge and ophthalmic discharge. He also has a little bit of a cough now. We are concerned about him. He was also one that was down in the trailer. They had two different trailers show up, and we had a horse down at each. So we need to do a lameness exam on him. But he got Exceed on the day of intake. We need to take rads of him and do a lameness exam, like I already said. But his blood work, he had low platelets. They were 98, and normal is he's not that far outside of range. Normal is like 100 to 400. And his neutrophil count is way elevated. He had 19 plus, and normal range is like 2.3 to 9.5. So he has a raging infection, which we knew, and that's why he had Exceed the day of. So we need to recheck him and see how he's doing. He also had an elevated heart rate of 48, which isn't super far outside of range, but he was just painful enough for us to have him on our radar for his right hind leg. But
we're really worried about this guy. He also, his body condition score is 2. This is maybe the tallest Arabian I think I've ever seen. This is a big gelding, and he is very, very thin and very sick. So hopefully we get him through. This saddlebred Morgan Crest. It's always interesting. We always have this debate on intake day, what kind of breed is this? Because sometimes we don't even get to see if they're gaited or not. So she looked like a little, I can go with saddlebred Morgan Cross. She is 19. She is very sweet. She does have a little bit of a sway back. She has a grade 4 out of 6 heart murmur. But she also had indications of being dehydrated on intake, and we want to do more, and she was systemically stable. So often when we have horses that have heart murmurs, they're not stable, or they're painful, or they have something else going on. This mare was overall very stable. Otherwise, her physical exam was okay. So we have her down for a cardiac ultrasound. We pregnancy check any mare over a certain age, even if there's no indications of pregnancy. So we're going to do a pregnancy check on her. We are going to sedate her, and while we're looking really closely at her heart, listen and see if we can learn more about that murmur. She also has a little bit of elevated neutrals and a little bit of low platelets. So we see trends in horses that have been dehydrated or haven't been cared for, and those trends sometimes continue to trend in the wrong direction, and sometimes they address over time. So she has been turned out to decompress, and we will be looking closely at her later.
This is Lucas. We got to look him up by his brand, and his name is actually Black Zone. He was a standard bred gelding 19 that we had come in. He had some pretty significant DSLD in his left hind. He also had really swollen lymph nodes, and he also had a forehead laceration. And when we did a CBC chem of him, he had like no platelets. His platelet count was 8. So he also had really low lymphocytes and elevated neutrophils, which we're not surprised with a recent laceration. But he was also very, very anemic. And those changes didn't happen overnight, the anemia from that little bitty laceration and his platelet count. So he had something significant going on that would cause that change, not just the laceration, but because of all those things combined together, DSLD, it progresses, it's painful, there's really nothing we can do for it. It was already to the point where his fetlock was dropping pretty far. So
and he was just miserable.
Yeah, he did not.
That poor boy.
Feel good. So with all those things combined, he was also given the last act of kindness. Bless his heart. He tried to be a real good boy.
Oh, man. This was a 3-year-old stallion, also a standard bred, branded standard bred. We see so many standard breds that are just used up. This guy was severely painful. He, on palpation, had a fractured pelvis, and you could see that his pelvis was unstable when he was moving. He had severe pain on palpation of his lumbar spine. I was very gentle and careful. I actually don't know if this got caught on camera because I hadn't seen the pelvis yet, and I just palpate down the spine, and his reaction, he almost like went down in the chute just from gentle palpation of the lumbar spine. The left side of his pelvis was greater than 4 inches higher than the right side of his pelvis, and his left hind leg was also shorter than the right. So this horse had some major musculoskeletal abnormalities. He also had blood work abnormalities, and he was given the last act of kindness. And for a 3-year-old stallion, he was just lovely. He knew we were trying to help him. He was a very good boy. He let us give him pain meds, and we didn't want him to suffer anymore.
This is Kelpie. It's like our 25-plus-year-old Shetland pony.
Oh, yeah. That age is wrong.
Yeah.
She was at least 25.
Yeah. So she had micro-ophthalmic eyes, and they were also painful. She would squint, and they would tear, but she was such a good little girl. She would trot everywhere happily, being led. So both of those eyes would need to be nucleated if her blood work showed that she was stable. She also had dental changes and infection with her teeth. But when we ran her blood work, she had CBC chem abnormalities that pointed to anemia with liver and BUN changes. And BUN we look at with creatinine for kidneys. So she had liver, kidney, anemia, and then when we ran her Cushing's test, she was 338. And again, that range for normal for ponies and horses, adults, is like 17 to 60. So she had advanced Cushing's that was very high. But with her liver changes, her kidney changes, the painfulness of her face, we didn't think she would be a good, stable candidate for surgery. And we didn't want to put her through that if she was just going to continue to be painful in other places.
And this is another, I sound like a broken record, but this is another case where we already had her in our hospital and we already were immediately in love with her. And when you looked at her, some of them just look like they feel horrible. and she looked okay. I really wanted to remove her eyes, but she already was in kidney and liver failure and had Cushing's disease and had painful eyes and had no teeth. And it's like, if you just look at the one thing, you're like, oh, you know, we already were like, let's body clip her and let's do all these things. And it just would have been really unfair for her. I try to guess, if I don't know on ages. I mean, this pony easily could have been in her mid-30s, but I put at least 25. Anyway, not to rehash, but it breaks our hearts too, to see these ones that you're like, but let's try. And we have to go back to that objective data and go, this pony would have ended up suffering, even if she didn't look like it. She was really, really sick. And so we're thankful that we have the information to make those really hard choices. I keep talking on your patients. Do you want to take the next one? We're supposed to go.
We can share Miles.
I'm too chatty.
He got named Millie on accident because he was posted as a mare, but he's a stallion. And that age is also wrong. His paperwork said he was 20, but looking at his teeth, he's actually closer to 8 years old. He is bilaterally blind. His face is deformed where he's had a healing fracture on one side, so he's hit his face a lot because of his blindness. And he's pretty thin. He has mucopurulent discharge from his nose. He also has purulent discharge from both sides of his face. If you go and watch the footage, Dr. Lydia actually pushes on his face on this left side, and it just kind of comes out of where that facial crest is. He has a lip droop. He has a systolic heart murmur. There was a lot of noise when we were ausculting him, so we couldn't grade it per se, but we just knew it was a systolic heart murmur. He has the microophthalmic painful eyes. And we did blood work, CBC Chem. His white blood cell count was not elevated, which you thought it would be with all the infections going on. So that's kind of a concern, like why isn't his body mounting a response that's appropriate to what we're seeing clinically? But he did have mildly low platelets. They were still normal, but they're like 106 and low is 100. So it's like, why does he have these abnormalities, and why doesn't he have other abnormalities that you would expect with that clinical picture? And then because he had such mucopurulent discharge, we did a swab and sent it into the lab for a respiratory panel. And he was positive for equine herpes virus type 2, which is a gamma, not an alpha, which equine herpes virus 1 and 4 are the alphas that we worry about causing neurologic or reproductive, like abortions and things like that. These don't really cause that kind of disease. They more cause lymphoma, nodular diseases in the lungs, things like that. And they're a herpes virus, so they're for forever.
Yeah.
He also had Streptococcus zoepidemicus, which a lot of horses will culture for that when they have respiratory problems because it's a normal flora in their respiratory tract. But then there was also another one, and I'm not going to say it right. It's Streptococcus dysgalactiae equisimilis.
Great job, Dr. Gina.
Thank you. And that one's we're not so thrilled about. We're really, really worried.
If your vet doesn't know how to pronounce the disease or the bacteria, that's never a good sign because it means we haven't heard of this before.
It's similar to strep pyogenes, which causes really significant diseases in people. It can be mild from just a skin infection, but it can go all the way to toxic shock. So we're not super thrilled about those results, and we're really worried about him overall because generally speaking, he is not doing so well.
Yeah, I looked up a quote that I found to be really helpful. He has so much going on, but even just the EHV2, and this is, I should have written down where I got it from, I don't know, some paper, said EHV2 is a gamma herpes virus that produces lifelong infections characterized by variable periods of disease recrudescence and latency. And what that means is animals with this type of herpes virus are never able to clear the system. And recrudescence means you get better, you get sicker, you get better, you get sicker, you get better, you get sicker your whole life. And periods of latency means you might not be shedding that disease, so you can't spread it to others, but you're always a risk for shedding it. And for those of you guys that followed the donkey respiratory disease, that was an equine herpes virus. So this guy poses an infectious risk to humans. He poses an infectious risk to other equids around him, both horses and donkeys. And on top of that, he's got major systemic abnormalities and infections. He still needs to be castrated, and we need to remove both of his eyes. So we're very, very concerned about this guy. And these are the cases that are so heartbreaking because he's way younger than we thought, and he's just an absolute love. He's such a sweetheart. And we are trying to manage his pain and trying to manage his infection, but we are very concerned. We did not even allow him to stay with his quarantine group. He is in a separate quarantine field by himself. So currently he's not posing a risk except to his human caregivers, which we need to take very seriously.
All right, this is Baron, and we also looked him up based on his brand, the standardbred brand, and he's called Seeking Arthur. That's his registered name. And he's 13. He's dark bay. He was quiet, alert, and responsive. He's halter broken. He had a normal temperature. He had a slight head tilt, and he seems to be blind in his right eye. And his right front fetlock, the picture, you can't really see it too well, but if you see him standing out in the field when he's actually bearing weight, is really puffy and swollen. We didn't have a chance to radiograph it that day, but we need to radiograph it and see what's going on in there, and see if it's anything, if it's just soft tissue or if there's more to it, to find out what's going on with him. But we also did a CBC chem on him, and he has a high neutrophil count, almost outside of normal range. It's just slightly over. It's like 9.54, and upper range is 9.5. His platelets were borderline low, and his chemistry, he had an elevated CK, which you look at for muscles. So he had CK, which was elevated, and his total proteins and globulins, so inflammation. So it's trying to find out if that's somewhere else in his body or if that's related to his foot. We're not quite sure, but.
And his heart rate was normal. So we always want to give them as much of a chance as we can. And if their pain is managed enough that we can ask them to go through the rest of that quarantine period with or without medications, often we do put them on medications in quarantine, then we give them time to decompress and we put them down for more diagnostics. So hopefully we'll be able to figure out exactly what's going on with this guy. B24, 423 are supporters named Rory. Rory also had a readable brand, and her name was Brooklets the One. She was born in 2002, so she was 22 years old. And she had, you can see in this picture, she was non-weight bearing lame on that left front leg. And she had a fractured left carpus that we were able to confirm radiographically. Also, unfortunately, her right forelimb had an active digital pulse. So often we get support limb laminitis when a horse isn't able to bear weight on one of those front feet. They bear 60% of the weight in the front, 40% in the back. So that right front leg has been holding 60% of the weight, and has started to give out. And this poor mare, she was so sweet and so painful and just exhausted. As soon as I gave her pain medication and she started to relax, her whole body just shook because her muscles had been so tight and trying to hold herself. And you can see in her face, I mean, she had been painful for so long. Obviously, we did give her pain medication right away, but she was given the last act of kindness.
Oh, Marshmallow. Marshmallow is a 6-year-old mare mule. She's white, as you can see in her picture.
She's real naughty.
She's real cute, though. She wasn't very much handled. Hopefully our gentlers can work wonders with them like they have with the other horses that they've worked with. We're really excited for them being here, side note. But she was very scared and very unhandled. So we just did a really brief exam on her, but she seemed to be stable and fine other than being scared. So Dr. Lydia wanted us to note that she immediately yields to pressure, which is great. So there's hope for her. So she got all the things, which was microchip, rabies, 5-way, strangles, and Quest, plus the dewormer and Equispot. And then she was like, oh, so she's up there decompressing.
And the mules often don't get the best grass, but this time of year we have tons of grass. And all the mules are like, the grass is the best thing ever. If you notice, they want nothing to do with the hay. They're all out grazing. So it makes me happy that they got some good grass. I keep getting the bad ones.
Sorry.
Cream puff. Listen, it was a hard day. This was a really hard call. This mule was at least 30 years old, probably older than that. Probably is related somehow to the other mules, but she had really malodorous smell coming from her nose and mouth. And in lieu of putting the dental speculum on, we just took radiographs, and she had less than 30% of her teeth left. So horses need that grinding surface to reduce particle size. Her body condition score was okay. But in looking at adoptability and what's fair to these animals, we don't ever want an animal to leave Horse Plus and then end up starving. And that is essentially what happens when they're not able to reduce the particle size. The hindgut isn't able to utilize that foodstuff. And even if they're taking it in, if their body isn't able to utilize it, they lose condition and they pass from that. So I made the really hard call to elect humane euthanasia. Not just because of her teeth, but because of the obvious infection that was happening. She also had nasal discharge and some lung component. And her feet were in really bad shape.
This is Knight. He's another one of these little white mules that came in. We aged him at 8 based on his teeth. He's a little piebald boy. He's real cute. All these little mules are really cute. He's alert, responsive. He seemed halter broken. He seemed relatively comfortable with being touched and handled. So he had a minor injury over his right eye that will heal on its own just fine. He has club hooves, which we see a lot in our mini mules and donkeys that we get here. And we checked him, and he didn't appear to have any masses yet. A lot of the gray animals will start to get masses or melanomas or things like that, and he didn't have any of those, so that's great. And he got all the things. So he got his rabies 5-way, strangles, Quest Plus, Equispot. He does have a stereotypy behavior. We noticed when we let him out, he was gate weaving or fence weaving, where they just kind of go back and forth, and that's a stereotypy that really stressed out animals usually show or present. You know, horses are supposed to be field grazers, and when they're stalled or things like that, they start to develop these weird behaviors. So that's just something we kind of wanted to keep in the back of our minds with him.
Have you seen him do that at all in pasture?
No.
I also have not. So I think that's notable. Stereotypic behaviors can be emancipated, which means some of these guys that do this, you can take away the reason why they sway. You can give them, enrichment and new space, and they'll continue to do it. That is an emancipated behavior. In this little guy's case, he only swayed when he was stuck in a very small pen, and as soon as we turned him out, he stopped doing it. So that's a really good sign that indicates that his mental health and ability to heal from that abnormal behavior is positive.
Yeah. We ran a CBC on him, and his white blood cell count, his neutrophils in particular, were elevated, and his eosinophils. And that was kind of like usually that we see eosinophils elevated with like parasite load, but
or allergies.
But
we dewormed him, so we'll recheck him and see.
So that was just something that's kind of like, usually don't see it like that unless you're worried about parasites. But all these guys looked really good.
This little mare. Oh, all right, hang on, I'll find it. Now we're going out of order. Here we go. This little mare is 24 years old. Someone loved her. At some point, she already had her right eye enucleated, and she's got limited vision in her left eye, so that's a concern. She also does have some dental concerns. Her mandible doesn't move well left to right. She does have a little mass on her right shoulder and some ventral pitting edema. And on her blood work, she does have anemia, reduced platelets, and other signs of inflammation. So she needs additional diagnostics. She also needs a dental. 24 is tough because these geriatric horses, you guys have heard me say a gazillion times, age is just a number. It's not a disease. And sometimes an older horse can be a great fit for a younger person. So we want to give them every chance that we can, but we are worried about this mare. So she got turned out to decompress in quarantine, and we'll continue to keep a really close eye on her.
Memphis.
Yeah, we're close to being in the right order. We're just not quite. We assigned B numbers because we posted the pictures on our Facebook page, and then we took the horses that they come in. So this second half, you'll see us shuffling through our papers because they're not all the way in order.
Yeah. Memphis is our 3-year-old gelding gaited cross horse. He's super cute. He's coughing a little bit. He has a scar over his left coronet on the lateral aspect, which is just, it could be nothing, it could be something, so we'll just have to keep an eye on that. He did have a swollen sheath, so that is something, whenever you see edema, it always goes to the most dependent place, but it's always like, why do they have that? Is there something more going on? So we're worried a little bit about his systemic health, but otherwise he seemed pretty normal systemically. So we were wondering if he maybe has some trauma or something neurologic in the hind end. He seemed kind of a little off in the hind, and his left shoulder was also looked a little like atrophy. So we don't know if it's something contralateral lameness or if there's something else going on.
I think this is the one that Tawny took the rads on.
Oh, yeah.
This is the left front.
Oh, he had the left front fracture.
If we seem confused, sometimes we delegate diagnostics. So Dr. Gina's reading her notes. Mm-hmm. Tanya might have to jump in here.
Yeah.
But yeah,
he was definitely had a lot of pain on his left front. So yeah, that's right. You showed us the radiographs afterwards.
It was a horrific fracture. This was the one that you took rads of that left front.
Coming back here so I can be closer to the mic. So he was painful, and we could tell that there was something wrong with his front.
He was neurologic in the hind.
Neurologic in the hind, and then on the left front, it looked like it was crooked, like he couldn't stand right. So we did humanely euthanize him, and then took an x-ray afterwards, and it was a horrific x-ray.
Just shattered.
It was like the coffin bone itself was, it was terrible.
Yeah.
And
displaced in a bunch of different places.
And as young as he was, if he stayed in that condition, he kept growing like that. That would have just broken down more. So
yeah.
I'll get behind the camera again. We are short-staffed on camera people, so I am multitasking here.
Poor little Memphis.
And I think also worth noting, intake days are a lot, and then our primary job is to care for the animals that we have. So Dr. Gina and I have not looked back through these notes. If you see us taking a minute, don't automatically think we have no idea what we're talking about. We process a lot of information, and sometimes like different people's handwriting is in different spots. So we get everything done.
Or like we're real hopeful at first, and then as you read the paper or remember the case, it just kind of kept getting worse.
Yeah.
So.
Okay, next horse, please. Great job. I'm sorry for interrupting.
No, you're
but
fine.
all of a sudden I was like, oh.
McGee.
Okay. McGee. We're also worried about this little guy. He is turned out with his other mule friends. So this little old man I put him down as mid-20s. He was very bad for needle pokes. And while we were trying to draw his blood, he smacked his face. So I had to sew his face up during intake, which he was great for. He does know how to lead and yield to pressure. And he loves treats. He was very food motivated. He has a scar on his right cornea, reduced pupillary light response on the right, but he can see out of both eyes. So he has some abnormalities. I suspect he has bilateral cataracts. We took dental radiographs of him, and he is missing multiple teeth and has some sharp points. But because I had to suture his forehead up, we didn't want to do a dental at the same time. Our speculum holds their face open, so we kind of made some priorities there. And then we also ran blood work on him, and he does have some abnormalities on his blood work. So he's got some evidence of liver disease. His glucose was high, which is usually from stress. Not super excited about that. So I'm concerned about his vision, the changes in his blood work that indicate possible liver disease, and also his teeth. But anytime we can turn them out for decompression, we do, and then we'll follow up a little bit later. And he's very happy out there with his mule friends.
Monty.
Here we go.
Monty's super cute. He'll come up to the fence. He's very curious about people. He's about 12 years old, little mule. He does have a 3 out of 6 heart murmur that we heard. But as long as he doesn't have a really taxing job, he should be fine and live a long, happy life.
Just as long as no one sticks anything up his nose.
Yeah. Yeah.
He hated his strangles vaccine.
He did hate his strangles vaccine. He did have decreased noises on the left upper quadrant when listening to his GI tract, but that's not too uncommon with the horses we get when they're super stressed. But other than the heart murmur and the strangles, he was pretty good for everything else. We just have to do a dental before he gets adopted. But he got all of his vaccines and got turned out with his friends.
And to be clear, by strangles we mean the strangles vaccine, not that he has strangles, the disease. He just doesn't like anyone sticking things up his nose, which we don't blame him for.
I probably wouldn't like that either.
This little guy, our supporter's named Mickey.
Super cute.
He's only 3.5 and he's adorable.
Very cute.
He's very hard to catch, but he's also very friendly and loves treats. So that's always a really good sign. He had already been castrated when we got him, and his physical exam was completely normal. So he got all of the things, and I think he's going to make somebody a really good pasture buddy.
Splash.
Oh, this was a tough one.
Yeah, Splash was really hard. Splash was a 13-year-old spotted saddle mare that we got. She had a significant lameness in the left hind with lots of muscle atrophy, and she had like displayed some odd behavior that Dr. Lydia
She kept
observed.
almost falling
Yeah.
before we got her in the chute. She would stand and her leg would just collapse underneath her. I didn't actually see her fall.
Yeah, and she did like a weird squatting kind of position for a little minute, but that left hind was a very significant issue, and we were weighing whether or not we could treat it, but if it was something neurologic, there'd be no way to really get that back. But based on the way her limb was moving underneath her, we were concerned that it would just get worse and we wouldn't be able to keep her stable.
The other important part about this case was that this mare was extremely reluctant to let anybody touch her. We actually met as a team and had a little discussion. If you guys watch, our team talks a lot. And behavior, mental health is health, right? Mm-hmm. And we don't ever want to give up on something because of behavior. But in this mare's case, we weren't able to safely access her to do a thorough exam. We just knew that she was extremely painful. Actually, Tani's husband, Jason, was there, and it was really helpful because he's not a medical person. So he asked a lot of great questions. And one of the questions he asked was, why does it matter that there's atrophy? We talk about muscle atrophy. And in my mind, most soft tissue things are going to heal in about 8 weeks. You might have some atrophy, but when you have severe, severe atrophy, usually it means that human or that animal hasn't been using that muscle for a really long time. And the longer something goes on with a high level of pain, the worse your prognosis is for returning to comfort. So this mare was painful. She had an elevated heart rate. She did not want us to help her or touch her. And we went back and forth and we were like, what if we just turn her out? But then we said, if we turn her out and let her decompress and we can't get our hands on her and she does fall, she showed a lot of indications that she was going to fall, or if we're not able to catch her to give her appropriate pain medication, we're putting her into a really uncomfortable situation. And for a 13-year-old to be absolutely want nothing to do with human hands, you know, if she had been healthy, absolutely, we would have turned her out. But because we were really worried about her being painful on a daily basis and she needed daily assessment and care, we made that really hard call in this gorgeous young animal. And that was really tough for our team. Again, I'm stealing your patience. That was yours.
They're all our patients.
I'm going to let you do the next one.
There are
Poor Dr. Gina has to listen to me talk all the time.
Oh, Nephra She is the other Arab that we got on buyout. She's about 16 based on her teeth. She's also one that we are worried about. She showed some really odd behavior when they offloaded them on the trailer. She had a slight head tremor, which in a horse is never normal. I haven't seen her do it since, but both Caitlin and I saw it happen at the same time, and we looked at each other and were like, that's weird. So she's on our close monitoring list with concerns. She also has an unknown history, which most of the horses we get, we don't know their history on. So we just kind of have to keep a close eye on her. If she was used for breeding or anything like that, there are some diseases that horses can get that are foreign animal diseases considered in this country, and some are pretty common. We just kind of have to keep an eye on that because she did notice that she had discharge, but it's probably more of like a normal estrus discharge as opposed to something else. But anytime I hear discharge, I'm like, let me take a note of that. So we have to recheck her. Let's see, she didn't have any hitch in her mobility of her teeth, so she probably just needs a minor dental before she gets adopted if she passes all of her exams. And she got all of her vaccines and got turned out in the 10-acre, but we just have to recheck her and make sure that she's okay.
It doesn't make any sense to me why anyone would take any horse to a slaughter auction, but when you have a 16-year-old, looks to be pure-blooded Arabian, that's very sweet, why did that horse end up there?
Yeah.
We'll never know these horses' stories, but
Yeah.
sometimes it's just straight up neglect. But okay. Our next horse is Star. Star is a 19-year-old Tennessee walking horse mare. She is also very sweet. She doesn't like to be caught, but she loves treats. And physical exam-wise, she had some slight abnormalities. Actually, her GI sounds were really loud, and so I wasn't able to auscult her heart as accurately as I wanted to because her stomach was very gurgly, which often just happens in animals that have had periods of starvation and then have access to food again. So as we're getting towards this last half, this mare was processed on the second day, so she'd been eating all day since she got there to the next day. So we're going to double check that that cardiovascular auscultation. This mare has scars all over her body. Her mouth on both sides has depigmented scarring, so it looks like someone used a really harsh bit. She had scars in her mouth up over her gums, and she had scars on her hips, her rump, her legs. I mean, someone just really beat this mare up kind of everywhere. A lot of those were healing or healed, and there was no obvious overt signs of lameness, but whatever this mare went through, it was pretty tough. She does also have some signs of anemia. Her hematocrit was a little bit low. Her CK was elevated, so creatinine kinase can become elevated in times of muscle damage. So even just a stressful trailer ride can make that CK go up. And she was dehydrated and had signs of inflammation. But again, some of those same trends that you guys have heard us talking about. So she is turned out to decompress, and we are hopeful that we can get her to adoption. Next horse, please. Oh, he's very handsome.
Maverick. He's a Mustang that came in.
Uh-oh. Here we go.
6-year-old male. And I think Haley was able to find his BLM paper. He is beautiful, sweet, halter broken. The story that we got from the people that brought him in said that he was owned by a nice little old lady that put a lot of money into his training, but the trainer told her that he was too much horse for her. So he ended up in the slaughter pipeline somehow and ended up with us, thankfully. So he's great. He has a minor parrot mouth, but he got all of his vaccines and got turned out into the 10-acre.
He's very handsome.
He is very handsome.
So we have one more. I'm not surprised that we missed it. We had a lot of identical looking mules. So how would you pronounce that? Bogey?
Yeah.
Bogey. Okay. B24, 427. He is a 10-year-old white kind of piebald mule gelding. All caps. Very food motivated. This guy was like, you give me the treats, I'll put your entire hand in my mouth. But he was very sweet. He did not like to be poked. He has a little bit of club hooves in the front, which is very common, but otherwise his physical exam was completely normal. He's a very good boy, and he hopefully will be available for adoption soon. And that was the last of that group.
Yeah. There's a lot.
Yeah.
But I'm glad they all came here because
Yeah.
even if they got the last act of kindness, which we keep repeating, is
Yeah.
better than getting shipped off to another country hours in a trailer to meet
Yeah.
a really nasty, painful end. So
Yeah.
I'm glad we got to help them at least have a little dignity before.
Yeah. My favorite intake are the ones where our surgery list goes from like 2 to like 11. But thankfully, in this case, it means we have a lot of horses in quarantine that are relatively stable and that just need basic dentals and blood work rechecks and stuff like that. So lameness exams. That's all we got.